I'm Michelle Hussein, and welcome to the next session of Virtual Wish 2020. We've probably all talked this year about unprecedented times, and with the immense impact of COVID-19, another pandemic, one that millions of people around the world live with and have done for years, is easily overlooked. Every year, there are more than 1 million new cases of HIV/AIDS. The epidemics of malaria and tuberculosis are also ongoing. The Global Fund is a partnership that works to fight all three diseases which together account for more than 2 million deaths a year. That number is, however, about half the number of deaths at the peak. Now, though, the Global Fund is warning that COVID could soon wipe out years of progress. And its Executive Director, Peter Sands, joins us now. Welcome, Peter Sands. Why do you say that years of progress on these three diseases could soon be wiped out?
What we've seen since the emergence of COVID-19 is very high levels of disruption to programs to prevent, test, and treat HIV, tuberculosis, and malaria, the other three biggest infectious diseases in the world. In fact, 70% of the Global Fund's programs across the world report significant levels of disruption. And there is a huge amount at stake here. We're talking about diseases that kill over 2 million people a year, and we could lose up to a decade's worth of extremely hard-won gains in reducing infections and mortality.
But is that disruption due to the diversion of resources, lockdowns, health workers being put on the fight against COVID instead? What is it that is causing that?
It's sort of everything. What we've seen is diversion of resources. For example, much of the testing for COVID-19 is actually being done using molecular diagnostic tools that have been put in place for tuberculosis and HIV. Now, it's a good thing those tools are there and can be used for COVID, but what we need to ensure is that we don't stop the diagnosis and viral load testing for HIV. But it's diversion of resources, it's huge pressure on health systems. Remember, many of these countries have much more fragile health systems than richer countries in the world. And also lockdowns have made it very difficult to run, for example, HIV prevention programs, education and sexual and reproductive health. These things have all had to move very swiftly to a remote, a virtual environment in communities where access to the internet is much, much more limited than we see in richer societies.
And which countries are you most concerned about?
Well, I would say I'm concerned both about pretty well all low and low middle income countries, but also even in upper middle income countries, key populations, marginalized, criminalized, often stigmatized populations. Actually, what we've seen is in some ways human rights related barriers to health have been exacerbated by the lockdowns. So there are vulnerable populations in a whole range of different societies. But it's not like we're just sort of letting this happen. The Global Fund, with partners, has responded very quickly to supporting countries and communities in working out ways to get around or mitigate the impact of COVID-19. And indeed, it's relevant to the World Innovation Summit for Health in that we've actually seen a lot of accelerated innovation, people doing things in different ways because of the crisis. And one of the lessons I hope we learn from this crisis is the benefits you get from rolling out innovation more quickly.
Can you give a couple of examples of that? Because that is exactly what the WISH community is all about, those kinds of ideas and sharing them.
Well, for example, for both HIV and TB treatment, we have moved very swiftly to digital consultation as opposed to face-to-face, to having courier-based distribution of drugs, to having multi-month dispensing, so people don't have to have the drugs delivered to them quite as often. If I think about bed net distribution for malaria, the traditional method was you would take all the bed nets in a truck to the center of a village, then all the families would gather and take them back to their households. Obviously, from a COVID point of view, that's not a very good idea to have everybody gather. So we've shifted to having health workers, volunteers on motorbikes going house to house. But the interesting thing is we've been using GPS tracking to ensure that every house is covered. And we're actually getting a higher level of household coverage of bed nets through this method than we used to through the method of just bringing it to the center of the village.
So there are positive changes that have come, but you are making an urgent appeal for the funding that you'll need to try and get things back on track against HIV, TB and malaria in the next year.
Absolutely. The Global Fund reckons we need about $5 billion over the course of the next year, both to mitigate the impact, the knock-on impact of COVID-19 on HIV, TB, and malaria, and to help countries respond to COVID-19 itself, because we've been one of the principal providers, for example, of testing for the poorest countries and communities in the world, and for PPE, for frontline health workers. Many of these countries have far lower ratios of health workers to population than richer parts of the world. We simply cannot afford to lose those health workers who are putting themselves at risk every day.
Can we talk a little about the relationship between COVID and fighting COVID and each of the three diseases that you work on, given how quickly the world has come together to try and find a COVID vaccine? Does that give you hope for a vaccine against HIV? Because in all of these years that virus has been with us, all of those deaths, all of those new infections, that hasn't, while we've done a lot on treatments, and people are living with the virus and with AIDS, the vaccine has never got there.
I hope that COVID actually is a stimulus, a catalyst for us to rethink our approach to the other three big infectious diseases. We don't have a vaccine against either HIV, TB, or malaria. The contrast actually is very stark. TB is the biggest infectious disease killer in the world up till now. And this year, 2020, COVID-19 and TB will be in pretty similar territory on current trends as to how many people they kill. They will probably each kill somewhere around 1.5 million people each. But there the comparison ends. To start with, on January the 1st, 2021, we will know how many people in the world have died of COVID-19, but we haven't invested in the same data systems for TB. We will have to wait till October 2021 to know how many people died in 2020 of TB. And likewise, the money. Total global spending on prevention, treatment, and testing for TB in the world in 2020 will be about $6.5 billion. The number for COVID-19 is not 100 times more, it's several hundred times more. And likewise with all the innovations, as you said, vaccines. If I look at the R&D pipelines for TB, I can point to a handful of products that might be coming in 2020, new tools to fight the disease coming in 2021. If I look at it for COVID, we're looking at several hundred. So I could talk through that with HIV, I could talk through it in malaria. The fundamental picture is the same, is that we should use COVID-19 as a catalyst to say, why are we still satisfied to be allowing so many people to die of diseases that really we know we can beat?
should we also be looking carefully at the potential overlaps, for example, between treating malaria or the Bcg vaccine that's been used against TB and some people are pinning their hopes on against COVID as well? Is there a relationship there that the fight against both diseases could benefit from?
There are lots of interconnections, and indeed, most of low and low middle income countries' responses to COVID-19 have been off the back of the capabilities in infrastructure that have been put in place to fight HIV, TB, and malaria. The supply chains, the laboratories, the frontline health workers, the community systems are the same. It's also really important that we get very good at differential diagnosis. So if a child presents with a fever, is that child got malaria or have they got COVID? If somebody comes in coughing, have they got TB or have they got COVID? And so we need to sort of treat the person, not just the individual disease. You mentioned the Bcg vaccine against TB. This is a good indicator of how we need to be careful not think that vaccines are a silver bullet. BCG only really works against pediatric TB. You still have 10 million people a year falling ill with TB and more than a million are dying, even though we've had this vaccine for many, many years. As we think about the fight against COVID, it's really important that we absolutely accelerate and deploy vaccines as quickly as we can, but we also deploy treatments and we also deploy testing. We need the full armory to be able to really defeat the pandemic.
But also, should we be mindful of the problems when you do have vaccines developed that are not widely used because their efficacy is not as it should be, and that's been the case with malaria?
You absolutely need to be very careful about the clinical trials, the efficacy, the safety profile, and the way that the performance of different medical tools is communicated to the public. Because if you lose the public's trust, then it's very difficult to actually get everybody comfortable with having a vaccine, taking a treatment, or for that matter, for isolating themselves. I think one of the big lessons actually that can be learned from the fight against HIV, TB, and malaria is that you absolutely need communities involved. You need community leadership, community buy-in, because if you don't have that, and many countries have seen this as they've tried to do test, trace, and isolate with COVID, if the community doesn't believe it, it's not going to work.
Peter Sands, Executive Director of the Global Fund to Fight AIDS, Tuberculosis, and Malaria. Thank you very much.
Thank you, Michelle.